So tonight we are joined by, as I mentioned, the lovely Tim. Tim, where are you joining us from and where is the pharmacy you work from?
Hello, so my name's Tim Stewart. I'm obviously a pharmacist. Currently, I am at home, but usually I work out of Coolum Court Pharmacy in Western, in Canberra. We also do have a few pharmacies throughout the central west of New South Wales, and also Bendigo and as far up as Armidale. So we base ourselves mainly out of obviously Coolum Court, but can also do consultations out of those pharmacies as well. I can get you a full list of those later on. So we started this off back in 2013 when one of our regular customers came to us, and he'd been told by his urologist after he'd just had a radical prostatectomy that he needed to go and get this vacuum erection device. And he was a bit overwhelmed. He had no idea where to go to find out any more information or where to actually get the device from. And neither did we. So we kind of gathered that this would be a pretty big problem for a lot of men out there. So we did quite a bit of research. The service has grown a lot since then, and we've obviously increased our knowledge quite a lot since then. But now we're gaining referrals from urologists, GPs, physios, nurses from within our local area, but also throughout New South Wales. I have to say this is a brand new thing to me, just talking to my phone. Hopefully it gets across okay, but this is our first kind of venture throughout Australia.
Tim, that's really wonderful to hear. Look, Tim, you're handling the spotlight so well, and I'm sure that last line was just so full of confidence that I'm in fact going to take my video offline, just so you mentioned, just to make sure that the highway of internet is completely clear for your wonderful face of knowledge to come straight through. So my video will be off, Tim's is going to stay online, and we're going to get into the questions. So thank you so much for that introduction, Tim. It's wonderful to hear that you clearly identified a problem that was coming to you from listening to patients, and you're out to solve it in a better way than I think a lot of people are doing. So well done. I'd love, first of all, a lot of the questions that were coming in before this webinar were to get a real 101 on Trimix injections. Which is of the traditional kind of injection route that a lot of people will be recommended. So I'd love to know from you, could you give us a bit of a 101? So with injections, how are they performed? What's a typical dose, shelf life, side effect? I'm sure this is old hat to you, off you go.
Yeah, so Trimix is, I guess, an alternative to another one that a lot of people would be recommended, which is Caverject. So Trimix has 3 ingredients, as the name might suggest. So the first one is alprostadil, which is the same as what's in Caverject itself. The other 2 are phentolamine and papaverine. Now, these kinds of things can be used to dilate blood vessels for blood pressure and all sorts, but obviously in this formulation, it's been used to dilate those blood vessels to allow lots of blood to flow through the cavernous tissue and cause an erection. So the typical dose of a Trimix, it's very hard to say. It's so variable. I guess in the range of, we use insulin needles generally to draw up the amount that we're going to dose with. So we call it units rather than mils. But typical dose would be anywhere from about 15 to say 30 units, which would be kind of like 0.15 to 0.3 mils, you could say. So I guess just a real quick run through of how an injection is performed. It would take me probably 15-20 minutes to go through this completely. And if you would like to do that, then please get in contact. We'll give you those details later, but just a very quick run through. So this is the typical type of syringe that you would use. Hopefully you guys can see that. This is a typical type of syringe that is used, and that's an insulin syringe to dose Trimix. The actual dose comes in a vial. Unfortunately, I don't actually have a vial with me, but you can imagine a vial. That's the needle itself. So to start dosing, you would draw down to the amount that you're going to dose with. Now, this isn't going to be a guessing game. You would talk to your doctor or your injection therapist to start with anyway. You'll draw it down to the amount that you're going to dose with. You'll pop that into the vial. So the needle goes through a rubber bunger in the top of the vial. You'll insert that air just to equalize it a little bit. And then you'll draw down the amount of liquid that you're going to inject. Now, that amount of liquid obviously equates to the dose that you're going to be giving yourself. Now, it's important to hold the vial upright and kind of upside down, you might imagine it, because otherwise you may end up injecting air. This isn't going to cause any problems, but it's obviously not going to work. So imagine the penis like this. Sorry. So to start with, you would pull the foreskin down, if you've got one, of course. You would stretch the penis out away from your body, and you want to inject it in kind of an area. If you imagine the penis as a clock, you would inject it into either 10 o'clock or 2 o'clock, we usually say. So that's on the top side of the penis, not the side, not the bottom. You want to inject either 10 or 2. You would swab the area with an alcohol swab first. You would hold the needle like a dart, or the syringe like a dart, and then just straight in. So you want to avoid any visible veins or arteries. If there are any, just inject a different spot. Once it's in, you'll push the plunger all the way in, and then you'll remove that and put it straight in a sharps container. Then you'll put a good amount of pressure onto the site that you've just injected into, and then you'll start massaging quite firmly. You want to do that to help the blood start to flow, and also to spread the medication throughout the penis. So that's a very quick and general run through on how to actually inject Trimix. It, in a lot of ways, is very different to Caverject, if you may have learnt that, but also is very similar. So some of the side effects, well, the main thing with any kind of injection could be a small prick or a sting, and that's the obviously the needle injecting itself. That is pretty much expected, but can be avoided by a couple of methods, which I can go into later. The other side effects, typically it's not a systemic side effect, because the drug is literally just being injected into the spot where we want it to work. So most of the side effects are in the penis itself, and generally it's a bit of pain. If the pain is more than just a bit, there are methods that you can use to get rid of it. And if it's obviously lasting longer than what you might want it to, a typical erection after one of these injections should last about an hour. That's an ideal time frame. That might sound like a bit long or a bit short, depending, but an hour is about what we're aiming for, to have that really good oxygenated blood flowing through the penis, getting that tissue stretched as well. So an hour is ideal. If it's going up to, say, 2 hours, you want to start thinking about getting rid of the erection. And the way to do that is essentially by doing anything that's going to constrict those blood vessels to get the blood out again. So a couple of ways is pseudoephedrine tablets. Now, all of this advice, of course, you should run through your doctor or pharmacist first, because these aren't suitable for everyone. But that's an example of some Sudafed tablets that you would take. The guidelines say 120 milligrams. So this particular one here, you would take 2 tablets of that one. You would use an ice pack or a bag of peas or frozen peas, of course, to try and constrict those blood vessels as well. You could also jump in the shower, cold shower, make sure those blood vessels are being constricted to get rid of the blood out of the penis. That will typically do the trick, and you won't need to do anything further. But if it gets to a point where the erection is lasting, it's going on, say, 4 hours now, that's considered a medical emergency, and you need to seek medical help. Namely the hospital. Very, very rare, but possible, and you need to know what to do if it happens. Can it be used on a regular basis? Or I guess more to the point, how often should you use it? For prostatectomy rehabilitation purposes, we generally recommend once to twice a fortnight. If you can't do it that often, do it as often as you can. If you want to do it more often, we wouldn't recommend any more than, say, twice a week.
Yeah, it's good to know, Tim. Actually, I did get a question in from Edmund from Adelaide who wanted to know if it was similar to a diabetic using insulin, you know, how often really can be too often. Is there a reason that it's only twice a week?
So if you're injecting into particularly the same area quite often, you can cause a bit of scarring in that area, and it can get to the point that it can cause a bit of a bend in the penis. You might know it as Peyronie's disease, and that can be induced by multiple injections in the same area. So for that reason as well, we do recommend to alternate the injection site each time you do it. So even if you're doing it, you know, once to twice a fortnight, you would do it one side one time, and then the next time you do it on the other side, and that can avoid that.
That's great to know.
Yeah, if you're doing it that often, the scarring, the chances of that happening are very slim. But again, you have to go about things correctly so that you don't put yourself in a situation where that might happen.
Absolutely, Tim. Look, it reminds me, I got a question through this week as well from Fiona from Sandringham, and she actually asked, is it possible that the needle could cause damage to the penis if it is done incorrectly? She mentioned that sometimes her husband has bruising afterwards, and of course that is alarming her. I'm wondering what you would say for that.
Bruising is absolutely not uncommon, and it's not harming the penis at all. Upon multiple injections, as I mentioned, it can cause a slight scarring, but that risk is extremely low if you're alternating the site and only doing it as directed. The only other way that you might be able to cause a slight bit of damage is if the needle that you're injecting is bent. So I'd always recommend to check the needle prior to injection. If it's bent, do not use it. Either change the needle or just abort plans. The actual injection will not cause harm if you're doing it correctly. And especially the bruising, it's not uncommon. That's just little capillaries that have kind of burst and caused the bruising, just like anywhere else on your body. And I wouldn't be fretting about that.
Great, good to know. Another question actually came up in our last webinar, and I actually want to make sure I'm correct in saying this. Now, Viagra or Cialis and injections, they cannot be taken together. Am I correct in saying that?
Yeah, that's correct. So they are not recommended to take together whatsoever. They increase your risk of getting priapism, which is what I mentioned about that prolonged erection that can be a medical emergency. That's the main thing, but it can also cause hypotension, so your blood pressure can drop a bit too much, which you don't want, and you could end up on the floor in a heap on the floor. So we don't want that to happen. Wouldn't recommend taking them together. Of course, if it's under supervision by a urologist or one of your doctors that has recommended that you do that, then that's okay. That's a different story. But absolutely, I wouldn't recommend taking them both together otherwise.
Yeah, good points, Tim. Of course, we've got this, I think, makes it so clear as we go on about the health and safety side, how important it is for somebody to see an injection therapist or a doctor. In fact, one of the questions was, does somebody have to get a script for injections? And I'm assuming that's a yes, right? A very positive yes, and advice if possible.
That's right. Yeah. So prescription-wise, most say GPs won't have anything like Trimix on their computer system to even look it up. So if they haven't heard of it before, you may need to educate them or get them in contact with someone that's had a bit of experience with it. The only one that's proprietary made is the Caverject. And that's made by Pfizer. So that's an easy one to get a prescription from your doctor for. If you were kind of venturing down the way of Trimix, though, definitely does need a prescription. Might be a little bit harder if you're just heading into your regular GP. They may not know too much about it, but that's where you can step in with a bit of education. And the more GPs and health professionals that know about it, the better.
Sure, absolutely. Well, hopefully this recording will get to a few out there, which would be fantastic. And I've got a couple of questions that are coming in that are around the non-needle side of things, but I thought we'd finish up maybe talking about the needle side with a question I got through from Keith. and he asks, after he tried injections 12 months ago that had absolutely no effect, he's wondering if it's now too late to try and resume this method, or what kind of advice you'd give to somebody, say if the injection really hadn't worked after a few times they'd used it, or if it had been quite a while that they'd had ED and then they came to this method.
Yeah, I would suggest that it's never too late, especially for injection therapy, and that's because the dose range is so large. The technique is quite important as well. So I think a bit of troubleshooting and possibly dose adjustment may have helped everything happen. Obviously, back then there may not have been too much recommendation or guidance onto how to dose adjust or how to possibly get a more potent injection, but there are so many options out there in terms of injections themselves. So I would keep your options open. If it was, say, for example, Caverject, that was the injection therapy that had been tried before, the maximum that can go to is the 20 micrograms. You can actually get alprostadil, which is the ingredient in Caverject. You can get that made up for you at a higher dose, but you can also get Trimix at a more potent dose as well. So if it was the actual dose that's hasn't worked, then that's easily managed. If it was the technique, that's also easily managed. And I would suggest that it's most likely either one or both of those things.
Right, sounds like you suggest, look, give it a crack and go with someone who knows the options. You can lots of things it sounds like you can play with there that could make more of a result. And in fact, we've got say the last question through on particularly Caverject versus Trimix. Someone's wondering whether the other ingredients in Caverject, does that give extra benefit to it?
Yeah, it does, for a couple of reasons. It tends to be slightly more effective, so in terms of actually gaining an erection in general, but it can also cause less pain. So the studies actually suggest for about, or up to 90% of those patients that have experienced pain with Caverject don't get as much pain through Trimix. And that's because the other two ingredients allow you to reduce the amount of alprostadil in the injection itself. So the dose of alprostadil that you're giving yourself is obviously lower, and that can cause less side effects like the pain.
Yeah, it's fascinating, Tim. That actually reminds me, I've had a few customers and they've talked to me about injection therapy. Some of them say, look, it's the pain that puts them off. And others have said they've experienced some numbness or some loss of sensation. Wondering if there's anything you'd add to that.
Yeah, so I mean, I think I suggested before that any kind of injection, it's obviously a needle piercing the skin. It can cause a bit of a slight prick or a sting, and that is usually accepted by patients after they've got their head around doing the actual injection. But having said that, if that bit is the bit that's turning you off, you can use like a local anesthetic cream, something like an Emla or Numbit cream, which you can get from your local pharmacy without a prescription. Or you can actually get devices. There's one called Coolies. There are other devices out there as well, but essentially you keep it in the freezer and you apply it to the injection site. It takes literally 2 or 3 seconds, and it'll apply extreme cool temperatures to the area to essentially numb it. So there are ways of getting around that slight prick or stinging, if that's the bit that's turning you off. But that's not the only reason that it can cause pain. So the erection itself can be quite painful. And that's because I often liken it to going to the gym for the first time in months or years, and having a really big workout. You're working these muscles quite a lot, and it's just not used to it. So the tissue of the penis is not used to being stretched that much. It's not used to being filled with all of that blood, because it's been so long that that's happened.
Yeah, I'm wondering, is that where the vacuum erection device could potentially come into this? I mean, we've had a small conversation before about how the pump and the injections can work together. I wonder if you could talk to us about that a bit.
Yeah, absolutely. So we always recommend to have the vacuum erection device or pump as a bit of a training mechanism. It's really good for stretching the tissue out, and also for getting the blood flowing. If you're doing that on a daily basis, say 5 or 10 minutes, like you'd recommend, Victoria, you can get the penis used to having all of that happening to it. All of that mechanical stress that it's going to be under while or after you've done the injection. So if you can, I would also recommend the vacuum erection device on a daily basis, just to train your penis to have that much blood flowing, have the tissue stretched, and then once you do the injection, it'll be less stressful on the penis, and therefore less painful.
Sure, getting that exercise in. Now, I think we should definitely move to talk needles for a while. Let's now talk about what actually instigated this webinar, which was a question I got in my last chat room, which was around Trimix Gel. Now, this flummoxed me. I hadn't actually heard of this, which is why I got in touch with you. You are the pharmacist I would get involved with my Ocean's 11 ED team, a film that I'm sure will absolutely be made after someone in Hollywood sees this webinar. I'm wondering if you could now talk us through what are the alternatives to the needle?
Yeah, so obviously, as much as we can talk about it, there are always going to be patients that are not keen on the needle, and that's absolutely fine. No one's going to make you use a needle. So one of the alternatives, as you mentioned, is Trimix, or you can actually get our prostadal gel, and that's an intraurethral gel. So this is an example of one here. So it's a pre-filled syringe. Yep, that looks a bit better. It's a pre-filled syringe with just a cap on it, and the gel is inside. You probably can't actually see it, but that's a gel inside there. And the idea behind this is you're not injecting it obviously through the skin, you're inserting it into the urethra and it gets absorbed through there. So the method of actual insertion, it can be a bit difficult. So I would recommend, again, the vacuum erection device to get a bit of stretch in the tissue beforehand. That can help you to be able to insert this gel. So maybe 5 or 10 minutes beforehand, use the vacuum erection device, get a bit of stretch in the tissue. Once you're ready to go, you'll have to hold the penis upright. I'll grab the gel, hold the penis upright. You'll pinch the glands, so the head of the penis, so that the urethra opens. You'll take the cap off and you'll insert the top of the syringe just inside the top of the urethra there. Now, this is only 0.5 ml, so 0.5 of a mil. Post-prostate surgery, your anatomy has changed slightly, so there's less stopping gel or otherwise from actually making it all the way into the bladder. So we need to do this very slowly. So once the tip of the syringe has been inserted into the top of the urethra there, you'll inject that 0.5 ml over about 20 or 30 seconds, and that's quite a long time when you're actually doing it. Again, I'd probably recommend the first one to be done with an injection therapist or with a doctor or someone that somewhat has an idea of what's going on. You'll need to hold the penis upright for at least a minute or so afterwards as well, and that'll help the gel to be absorbed. If you let it flop down, it's just going to fall out and not going to do too much. Now, all of that said, a massive advantage of it obviously is the lack of a needle, but it obviously comes with some disadvantages as well. So it does need to be kept refrigerated, which actually the Trimix needs to be refrigerated as well. On that note, inserting something that's refrigerated into the urethra can be a bit uncomfortable. So you would
I've
warm
actually,
it up
Tim, just to interrupt you, we did just get a question through, someone asking, in general, is it better to warm Trimix before the injection as it comes from the fridge? And it sounds like you're suggesting, no, it has to stay cold in both instances. Is that right?
So the injections, the intracavernosal injection, so the one that comes in a little vial, you can let it get to room temperature, that's fine, but actually warming it up to body temperature may not be a good idea. It does need to be kept refrigerated. Depending on the manufacturer, when I say manufacturer, it'll be a compounding pharmacy. Depending on their practices and what they recommend, it may last about 6 months or so in the fridge. The Trimix gel at a similar kind of time frame, but that has to be refrigerated that whole time. Obviously, these come in separate use little syringes, so you take one out at a time and use that. The injections, I'd recommend to get take the vial out, get it to room temperature, take your dose out, and pop it in the fridge as soon as possible. Obviously, if you're using it to have sex or masturbation or whatever it may be, it might be sitting in the room for, an hour or so. That's also fine. It won't cause too much damage at that point, as long as it's not in the sun or in, a very heated room. It will be fine. Just pop it back in the fridge when you can.
That sounds good.
So I guess. Sorry.
Oh no, I've got a flurry of questions coming through, and I'm aware we've got about 4 minutes left. We're doing great. Let's see how many we can get through. And of course, anyone throwing questions in, I'm sure that there's a chance that we will do this again. Or Tim, of course, is available for consult or to get in contact with afterwards. We've got one through asking how effective the gel is compared to the injections. I think it'd be an interesting one to hear about.
Yeah, so that is also a massive disadvantage, unfortunately. So effectiveness-wise, evidence suggests for erectile dysfunction, the effectiveness is about 35 to 70%. So it might work in about 35 to 70% of patients. Post-prostatectomy is often lower than that, or on the lower end, I should say. So close to that 35% hit rate, basically. For those patients that obviously don't want to go down the needle pathway, and they've got their injection right, they've got their technique right, and they can manage to get a dose right, and it works, then great. But there's quite a few things to get right before all of that kind of falls into place.
Yeah, sounds it. So it actually leads us on to Jenny asked a bit earlier, and thanks for waiting, Jenny. Is there an auto-inject system then? Say someone wanted the effects of injection, but again, circumventing that needle. Could you talk us through that?
Yeah, that's a great option as well. So obviously the needle, it does look pretty daunting, right? Not really something you want to be sticking into yourself. So you can get I don't have one with me, unfortunately, but you can get a auto-injector, which you actually insert this into the auto-injector with the specified dose that you're after. They usually have settings on them that you can change how deep it goes as well. And then you'll put the device against the skin. You'll do all your alcohol prep beforehand, of course. You'll put the device against the skin, press a button, and the rest is history. It all happens automatically. So you won't actually have to bring yourself to insert the needle into the skin, and you won't even have to push the plunger down. So that can be a great option for some patients.
Wow. How would somebody go about accessing that option?
So there are a few different brands that make it. By all means, contact me. My email address is tim@menshealthdownunder.com.au, or you can give us a call. I believe you'll have the details up later. We can supply them and send them straight to you. You can get them online as well. You'll just have to be careful and make sure that the device that you're using is compatible with obviously Trimix or the syringes that you will be using.
That's great, thank you. Now, I think we'll have our last question. Somebody mentioned a few minutes ago, asking whether they would have to wear a condom when they've used injections, or potentially the gel as well, because I'm assuming maybe the gel is a concern because that could leak out. He's wondering if the effect of that drug would have an effect on his wife. I think it's one of those good health and safety questions we should cover.
It is a great question. gel is mostly going to be kind of absorbed and kept in the shaft of the penis, in the urethra. So there will inevitably be a tiny bit that kind of comes out, and that's not going to cause any harm. If you're finding that you're getting a significant quantity of that gel come out, then the technique is possibly wrong. But if it makes you feel safer or a bit easier, then definitely go the condom method. The injections, definitely not. So you may get a slight bit of blood come out, obviously, of the injection site. That can increase the risk of the transmissible diseases that are through blood. So a condom definitely recommended in those cases. Other than that, it's non-essential. So you don't need to wear a condom, but it may be advisable in some cases. You can either make the judgment yourself or consult us for recommendations.
That's wonderful. And the last question we've got through the chat box is just the most perfect tangent for that. Tim, if people want to get in touch with you so that they can talk to you, maybe book a consultation with yourself, ask you maybe some more questions, how could they get in touch with you? Can you repeat that email address for us, or any other methods?
Yeah, so my email address is tim@menshealthdownunder, all one word, all lowercase, .com.au. So feel free to email me. That's probably an easy method of getting your questions through, especially if they're long-winded. But also feel free to give us a call at the pharmacy. So that phone number is 6288-1867. The area code is 02, since you may be elsewhere in Australia. And that's probably the best way to get hold of us. We will be, if we're not in the pharmacy at the time, or if we're in a consult, we'll easily be able to get back to you.
That's great to know, Tim. And in the follow-up email I'll send tomorrow with this replay, I'll also make sure people have a link to your website, email, and phone number. I'll throw myself back on video. Look, it's a shame you've missed out on a very enthusiastic listening face that I've had this entire time, especially seeing how the gel worked. That was wonderful to see through with the demo. So thank you so much for your time. And we'll leave it there for tonight. One final reminder, if you did want to purchase a pump, the Viagra is the one that I highly recommend. I've been getting just some really wonderful quotes and emails from people for the last week for our webinar last time. We talked about this in more detail. If you wanted to purchase this, it's just below the video. And if you like this webinar format, you will also have access to a monthly private exclusive webinar group where we discuss everything that goes on around ED in relation to pumps and otherwise. But Tim, thank you so much for your time today. It's been really wonderful. And have a good evening. Thank you very much, everybody, as well, who has joined us and asked some fantastic questions.
Thank you.
All good. Good night.